we'll go ahead and get started again. My name is Dr. Nina Ford Johnson, President of the Medical Association for the state of Alabama. I was having a conversation with my sister over the weekend about what's going on with the hantavirus, and she's like, "Well, what are you going to do about it?" And so I thought, well, let's do a Facebook Live. And I was trying to think about, well, which infectious disease doctor could I contact who wouldn't mind taking some time out of their busy schedule to join me? And of course, the first name that popped up was Dr. Scott Harris. Dr. Scott Harris is the Chief Health Officer for the state of Alabama for the Alabama Department of Public Health. But guess what, you guys? He's also infectious disease doctor trained. So he has a myriad of knowledge in this subject. Uh, the hantavirus, I only remember that from medical school, studied over 20 years ago, but he is very familiar with this topic. So we thank Dr. Harris for being with us today as one of the top docs or the top doc in the state. So, and we just want to give you guys some accurate knowledge for physicians and residents of Alabama. We just want to hear something that's accurate. And I think no place or no better place to hear it from is from other physicians in your state. So, Dr. Harris, for people hearing about hantavirus for the first time, what is that virus?
Yeah, great question, and thank you, Dr. Ford Johnson, for having me. It's really great to be here with you. Our department spent a lot of time on this in the past couple of weeks, and so I'm happy to share with you what we've learned. Hantavirus is a virus that's been known about for a long time, for many decades. It's in a family of viruses that causes diseases that most of us never deal with and have never heard of. There's a number of what we call viral hemorrhagic fever conditions that are usually pretty rare. They usually don't happen very often, but there's a family of viruses that cause those, and hantavirus is in one of those families. It's usually associated with rodents somehow. We think probably rodent droppings can be infectious, especially if those are aerosolized. Um, Hantavirus has been known about in Asia for a long time, and the first cases that really came to our attention here in the West were during the Korean War, when a lot of U.S. and UN soldiers were infected with hantavirus. But we never knew it was in the United States until about 30 years ago, a little over 30 years ago, in the southwestern U.S., what we call the Four Corners area with Colorado, Arizona, New Mexico, and Utah. That area saw several cases that turned out to lead to a few deaths, and that's when we realized that that virus was actually present here in the U.S. What's interesting is that the virus, even though it's in different parts of the world, has never really been known to spread person to person, with the exception of the one that we're seeing right now that originated in South America.
Yeah. How does someone get infected with hantavirus?
Yeah, so what we think is that this is a virus that normally lives in mice or rats, maybe some other rodents, and they seem to be, as far as we can tell, asymptomatic. They just shed this virus and it doesn't really affect them for the most part anyway. When people are around aerosolized droppings or things that like urine or saliva from a rodent, then the virus can be there and that can infect the person. So the classic case that has been seen in the US over and over, or people that have these cabins in kind of rural areas and these sort of dry desert-like areas. Many times during the winter, rats will hole up in those areas and have maintain their life during the winter when the owners aren't around. And then in the spring and summer, when people come back to these cabins and start opening them up and cleaning them up and getting ready to spend some time there, they can inhale, we think probably inhale aerosolized rat droppings. That seems to be the most common route of acquisition. Now, again, what's different about what's going on in the world right now is that we actually have seen, it appears, some human to human transmission, which has never happened in the US before, as far as we know, and is pretty rare.
So, according to what's been going on in the news now, is it something that we as Alabama citizens need to be concerned about?
This is really low risk. This is not a COVID situation. This is a virus that we know a lot about. This is a virus in the the form that we're seeing spread person to person doesn't seem to exist in the United States as far as we know. The rodent vector, the mouse and rat vector that carries this in South America doesn't exist in the United States. So I would say in public health, we're alert to these things. This is our job, and this are the kind of things that we monitor. We want to be vigilant. But the average Alabamian or even the average American really doesn't need to be worried. This is not something that's really a high risk at all.
Oh, that's good. What are some of the early symptoms that people should watch for, and how is hantavirus different from like flu and COVID and other viruses?
Yeah, so early on, they all look fairly similar. There are sort of two major forms of hantavirus. The one that I mentioned earlier that was first known about in Asia tends to cause kidney problems. It tends to cause what we call a hemorrhagic fever and kidney failure, and that was what people for a long time thought that was the only thing this virus did. But when it was discovered in the American Southwest in the early 1990s, it was because it was producing what we would call a hantavirus pulmonary syndrome, a serious respiratory type infection. So early on, people have fever, they have, they feel weak, they may have nausea and vomiting and headache, and you really wouldn't have any ability to know what type of infection was causing that because there's so many things that can cause that. But
Right.
what hantavirus can do is fairly quickly, within a couple of days of developing symptoms, really cause serious lung injury. So people, very quickly get extremely short of breath. They will seek medical care because they're really in an extreme situation. Many of these people end up on a breathing machine, on a ventilator, and the right now the best information we have is about a third of people who get infected with this do pass away from it. So it is a very serious illness, even though it's extremely uncommon.
Okay. And that's the message we want to relay to our Alabama citizens, that it is extremely uncommon. So, how can the public stay informed about hantavirus without becoming fearful, especially when we're seeing a lot of it in different headlines?
Yeah, so talk to your doctor, is always a good answer. This is different from COVID in that, when COVID happened, we were talking about a virus that none of us knew existed, only a few days or weeks earlier, right? We were kind of, as we say, building the airplane while we were flying it. We were getting all this new information. We really didn't know for sure how to predict what was going to happen. With hantavirus, that's really not the case. Now, anything could change. Viruses can mutate, and you can't predict the future. But generally, I would say this is a virus that we really know a lot about. We, understand where it exists in nature. We understand how to stay away from it. Your doctor, even as you mentioned, Dr. Ford Johnson, when you trained in medical school, the information you got then was pretty good information.
Okay,
We
good.
yeah, we do know a lot about how this virus is transmitted. So check reputable sites. Our alabamapublichealth.org website has a web page dedicated to this. Just go to our landing page and do a quick search there for hantavirus, and it'll come right up. CDC has done a great job of updating their web page on this. I've gotten a lot of information from that myself. I've spent a lot of time on calls with CDC over the past 2 weeks, as well as some other agencies as well. So there's good information out there, but just seek the people who are knowledgeable about this.
Excellent, excellent. And I'm so glad to hear that yourself and other medical professionals are staying on top of it and communicating with each other. But this is a virus that is well known to the medical community. And so that is something, it is not a novel, it's not a new virus. This is something that we know. Um, Someone did question, want to go back to physicians, because there are physicians watching this today. What key clues should raise suspicions for hantavirus in the ER setting or urgent care setting, or maybe even in the private sector?
Yeah, I would say really you're gonna have to ask for that bit of exposure history that's going to clue you in. When somebody presents with a serious respiratory illness, there are a lot of things that could be. Common things are common.
Absolutely.
Hantavirus is not common, it's not going to be the first thing that you think of. But right now, remember, we have a really small number of people who are potentially exposed to this outbreak. If I can remind you, what happened is about 6 weeks ago, this cruise ship left the southern tip of South America. It made several stops in the South Atlantic. It was, you kind of think of it like a hop on, hop off bus, except it
Mhm.
was a cruise ship, and you had people coming and going. But ultimately, there were three people on that ship that ended up dying from hantavirus. And right now, there's about eight other people that we know of for sure who were infected, and that's out of 150 people. And the ones who've come back to this country are currently in isolation or in quarantine, depending on the situation. And there really shouldn't be too many other Americans who are at risk. I mean, those are the people involved in that. It's not something that most doctors are going to think about, in an ER setting or in a clinic setting. Common things are common, and hantavirus is definitely not very common.
That's good to know. Again, not very common. So if you're coughing and runny nose with a fever, not likely to be hantavirus.
No, no, not unless you've been on a cruise in the South Atlantic, on that one boat. Yeah.
So it's okay for families because now we're about to hit really busy travel season with cruises. It's still okay to do that, correct?
Oh, sure. I would
Absolutely.
not have concern. I don't think people need to change their behaviors. For all travelers, the biggest risk to your health when you're traveling are your own underlying health conditions, right? So, if you're going to take a trip, talk to your doctor, make sure you're healthy enough to go, make sure you've got your prescription meds. If you take those, travel insurance is a great idea. If you have an accident or you need to get home, that's the standard advice we'd give to anyone traveling really anywhere. And other than that, there aren't really additional precautions that you need to worry about. If you're going to, this sounds almost silly, but this is really the true statement. If you're going to this one particular location at the southern tip of South America and anticipate a lot of exposure to local wildlife, um, okay, then you need to have a longer conversation with your doctor about that. But that doesn't apply to most travelers, and it's still a really, really uncommon situation.
Excellent. Excellent. Someone did ask about treatment. Is there any treatment available for this?
Unfortunately, not. There's no specific antiviral treatment. Obviously, supportive care is the way to manage people with this illness, and there's not much beyond that. Some of the cases that we've known about over the past 30 years have needed extreme supportive care, including, ECMO, extracorporeal membranous oxygenation, full ventilatory support. A sepsis type syndrome can develop where people have a low blood pressure and need their blood pressure support. That can cause other organ failure. So there's a lot of critical care treatment that goes into managing these patients in some cases, but there is no specific treatment for it, no antiviral drug. There's no vaccine really that's widely available. There have been candidate vaccines studied in other countries, but they don't really play a role in what we're seeing today.
Okay. Well, excellent. This has been some great, outstanding information, hopefully allaying any fears that any Alabama citizen or physician may have. Dr. Harris, as a closing remark, what is the single most important message you want Alabama families and physicians to remember today about the hantavirus?
We know a lot about it, and how people are exposed to it. People in this country are not at risk, for the most part, and we're learning more every day, and we'll let you know as we learn more.
Excellent, excellent. So we definitely want to thank you all for tuning in. We definitely want to thank Dr. Harris for his time and effort and the work that he's putting in to keep Alabama safe. You've heard it here first that this virus is nothing to be concerned about. It's very, very rare and highly, highly, highly unlikely to cause any problems here in the US. So please go about your daily lives, work, play, and enjoy your summer with your families. And we believe that everything's going to be fine. However, if anything changes, of course, you will be the first to know as we find out as well. Okay? Excellent. Thank you, Dr. Harris, for your time. Appreciate all of you for tuning in.
Okay,
Goodbye.
thank you very much. Take care.
Stay safe. Yes.